I'm Andrea Klein-Thomas, reporter with CBS New York, here at the 5th International Vatican Conference. We are pleased to be joined by Princess Dina Mired of Jordan. Not only is she here to talk about her amazing work around cancer care, she's also here to talk about policy. Princess Mired, thank you so much for joining us.
Thank you. I'm delighted to join you all.
Yeah, and why is it really important to talk about not just the medical and the science behind cancer care, but also to add policy to it? It really makes this conference stand out.
I really like this question, actually, because we've always been talking about and complaining about vertical silos, that everybody is working alone, talking about things. And we've just seen right now, in fact, with COVID-19, that, health is not just about a doctor with a medical bag. It's about a healthcare delivery system. And this system is influenced by politics. It's influenced by doctors. It's influenced by NGOs. It's influenced by faith-based organizations. There are many things that influences the management of cancer control per se. And that's why this conference really stands out, because, it really does the intersection, and it actually, walks the talk, so to speak, because, enough of speaking to the converted, preaching to the converted all the time. We need to connect with all stakeholders that influence healthcare delivery. And it's not just oncologists or technical people, it's everybody else.
What lessons have we learned from COVID-19 as it pertains to cancer care?
Well, ironically, COVID-19 required us to don masks, but actually it unmasked so many of uncomfortable truths about our health systems. And with regards to cancer care, especially patients from low, middle income countries, all the things that we have seen now, the lack of political will, with the beginning of COVID, the ununified standpoints about what to do or not to do, the lack of healthcare workforce that we all have been speaking about for so long. All of these things that COVID-19 has unmasked has actually been the daily lot of many cancer patients and cancer systems in low and middle income countries. COVID-19 is just really equalized the misery, so to speak, with high income countries, because it kind of brought it to their shores, so to speak. But so there are lessons learned, that unfortunately it's unfair or not nice that everybody had to experience the same in such tragic ways. That's not what we want. But in a way, I sincerely hope that there will be an opportunity now when people have seen, what it's like not to have masks, or not to have a healthcare worker, or not to have medicine available, or not to have a vaccine. People are fighting for vaccines and so on. For people now to really understand, what they should do post-COVID. So there's a big opportunity in building back better and really, sitting down and rolling our sleeves and really take these issues, head on, if we are ever going to make a dent in the fight against cancer.
We were talking about the unmasking. How do we begin to close those disparity gaps when we're talking about race, socioeconomics, all the different disparities that COVID has highlighted? How do we begin to close those gaps?
I think, first of all, we need to acknowledge them. I think we need to acknowledge them. Again, I keep saying we've been speaking about these things for so long. I know since I started being a champion of cancer and NCDs, we've been highlighting, racism in health. We've been highlighting lack of healthcare workforce. There's 18 million healthcare workforce that is, that we don't have in the world. We've been saying all of these things, but really now we need to acknowledge them, because, COVID-19 has exposed all of that, and nobody can now argue against those things. And we can do it. That's the thing. We can do it. And COVID-19 has shown us that we can do it. If there is political will, we can now, we've seen how fast vaccines were being produced. This is an unprecedented speed, that when all countries, when push came to shove, they managed to do a vaccine, and we are struggling to disperse it and so on, but it has shown us that we can fix things if we set our mind on it and plan to work together and to do something. So I sincerely hope that we now have learned. It's a big lesson and tragic at times, but we have no choice but to build back better and to take stock and to think about the things that we should do, including prevention, early detection, and all these things that we've been screaming about for far too long. We just need to make sure that we do all of these things, because the cost is just too big, whether in loss of lives or in terms of money.
Absolutely. Well, Princess Mired, it's been a pleasure speaking with you. Thank you for all of the great work that you're doing.
Thank you. Thank you so much. Lovely to meet you.